Hi, this is Medicosis Perfectionalis. Today is a very special video about oral findings and their associations. So, I will describe an oral finding and then you pause the video and try to guess what disease is associated with this finding. Let's get started. What about hyperpigmented gingiva? Pause. Correct. That's Addison disease. What if there are melanocytic pigmentation on the lips and the buccal mucosa? That's Peutz-Jeghers syndrome due to multiple intestinal hematomatous polyps. It's called Peutz-Jeghers disease. So, and the hyperpigmented gingiva is Addison. Okay, what if there is hyperplasia of the gingiva? That's usually phenytoin or dilantin toxicity. Okay, how about this one? You know these spots, white spots surrounded by erythema, they're called Koplik spots. They are seen in what condition? Yes, correct. That's measles. And they appear 2 to 3 days before the rash. Okay. Other condition, strawberry tongue. They're not together, like these are two separate diseases. I just combined them in one illustration. So, strawberry tongue could be scarlet fever, could be Kawasaki disease, or could be toxic shock syndrome. What else? How about a geographic tongue? It's an idiopathic inflammatory condition. There is loss of filiform papilla, the appearance of red patches, and they resemble a map. Okay, it's asymptomatic, benign, but there is an association with psoriasis. Perfect. How about this one? Okay, white stuff on the tongue. If you can scrap them off, it's candida. If you cannot, it's oral hairy leukoplakia. Okay, oral hairy leukoplakia is common in HIV/AIDS patients. It's due to Epstein-Barr virus. Okay, what if they are very smooth white stuff on the tongue, like this, white lines on the tongue? This is lichen planus. Okay, what if they are the same things on the tongue, but they are very red and dark? This is erythroplakia. By the way, leukoplakia is usually benign. Erythroplakia, there is 90% chance of either dysplastic or carcinomatous lesion. So erythroplakia are more dangerous than oral hairy leukoplakia. Perfect. What about beefy red tongue? It's usually vitamin B deficiency, B12, which is called pernicious anemia, also glucagonoma, glucagon secreting tumors. How about a big tongue, macroglossia? This is multiple myeloma, lymphoma, amyloidosis, hypothyroidism, angioedema, acromegaly, or Down syndrome. What else? How about this tongue? We call it a bald tongue. There is atrophy of the papilla of the tongue. syndromes or conditions such as pernicious anemia, iron deficiency anemia, xerostomia in Sjogren, also pellagra. Okay, these are the main lesions that you'll find in the mouth. Very crucial that you know this, very important to know for any exam in your med school or after that. Take care, see you next video. Please consider subscribing. Hit the subscribe button. See you next section.